Assalamu alaikum. I am Dr. Akmat, Associate Professor of Hepatology at the Awmc Medical College, Dhaka. Welcome to all to our lecture class. Today, our lecture class on cirrhosis of liver. Yesterday, I discussed about the etiology, definition, clinical features, investigation. Today, I like to discuss about management of cirrhosis of liver. Now, we are going to discuss about the management of cirrhosis of liver. Compensated cirrhosis may not be treated in urgent basis because it is incidentally diagnosed. But when the patient come with some severe complication, we need to concentrate. We know that prevention is better than to cure. It is a universal truth. How will you prevent cirrhosis of liver? You can prevent cirrhosis of liver in many ways. First of all, if the patient develops hepatitis B and hepatitis C, you must treat hepatitis B and hepatitis C when it is necessary. There are many drugs for hepatitis B and hepatitis C. And hepatitis C, it is almost curable disease nowadays. If the patient is alcoholic, you must discourage for alcohol consumption. If the patient has fatty liver and obesity, you must advise the patient for calorie consumption, reduction, and some exercise. We can prevent cirrhosis by many ways, and we can slow the progression of cirrhosis of liver. We should be cautious that some other factor which may be the responsible factor of cirrhosis of liver decompensation. For an example, if the patient is suffering from chronic hepatitis B, previously he or she was compensated. But if this patient suffering from hepatitis A or hepatitis E, this patient may be decompensated. So, where possible, we should prevent it by giving the vaccine for hepatitis A. Like other disease, the management principles are general management, specific management, and treatment of complication of cirrhosis of liver. General management. In our community, if the patient develops cirrhosis of liver, don't give protein at all, don't give fat at all, but scientifically it is not true. For good nutrition, you must give protein, you must give fat content, which is necessary for the good health for the patient. We have to avoid alcohol and other hepatotoxic agents like narcotics, NSAID, and other hepatotoxic drugs for the prevention of progression of the liver cirrhosis. Now, some etiological factor which is causing the cirrhosis of liver, I am discussing one by one. Although it is not common in our country, but in many parts of the world, alcoholic cirrhosis is common. So, for the first part of management, alcohol abstinence is mandatory for the reduction of progression or the management of cirrhosis of liver. These patients are frequently malnourished, so you have to provide some vitamin supplement. In some severe cases, you have to give steroid as well as pentoxifylline. Hepatitis B, it is common in our country. So, if the patient is diagnosed hepatitis B and it is causing cirrhosis of liver, you have to treat hepatitis B infection. Injectable pegylated interferon, which is expensive, but we can give it for the treatment of chronic hepatitis B and we can hold the progression of liver cirrhosis. Oral drugs, they are less expensive, but it is prescribed for the long period of time. What are they? They are lamivudine and telbifudine, aripiprazole, tenofovir, and entecavir. But when the treatment to be started, it is on the guideline, and we should follow the guideline for the initiation and discontinuation of the treatment of hepatitis B. Hepatitis C, there is a revolution in recent years for the treatment of hepatitis C, because previously the treatment option was only injectable, but it was less efficacious. But nowadays the treatment given orally, and it is very much effective as well as less expensive. So if the patient is diagnosed hepatitis C, we must treat for the cure of hepatitis C, and we can prevent cirrhosis. Although uncommon, biliary cirrhosis should be treated by ursodeoxycholic acid, obeticholic acid, and giving vitamin K injection and restriction of fat for this patient. Sometimes steroid and other immunomodulating drug is necessary for the treatment of biliary cirrhosis. Another important cause of cirrhosis of liver is fatty liver. It is also common in our country, especially the patient is obese and may have diabetes mellitus. He must search for non-alcoholic steatohepatitis, that is, you have to manage NASH when it is present. Main part of management of NASH is the dietary management. If there is comorbidity like dyslipidemia and diabetes mellitus, we must control it. There are some drugs which are used, but NASH cirrhosis cannot be reversed because cirrhosis is said it is an irreversible condition. But we can hold the progression or slowing the progression of cirrhosis of liver by giving dietary management as well as giving some drugs which are prescribed in our country as well as worldwide. Among them are ursodeoxycholic acid, and nowadays another drug which is available in our country, that is obeticholic acid, for the management of NASH and cirrhosis of liver. We have to manage dyslipidemia by giving atorvastatin or other lipid lowering agent. Nowadays, some newer drugs are tried, but I am not discussing this. Hemochromatosis, we must treat it. If the patient develops cirrhosis of liver due to hemochromatosis, venesection and drawing of blood in regular interval to reduce the extra iron content from the body. We should use iron chelating agent like desferoxamine. We should treat the complication like congestive heart failure, diabetes mellitus, and pancreatitis. Wilson's disease, we know that it is a hereditary disease for the disturbance of the copper metabolism. Wilson's disease cirrhosis may occur. There are some treatment options, that is penicillamine. It is worldwide, it is the important drug for the management of Wilson's disease. Some other drugs, including triamtine and zinc acetate, also may be effective for the cirrhosis due to Wilson's disease. In advanced case, liver transplantation may be necessary. We need to treat complication, and one by one, some of them we are discussing. The common feature of decompensated cirrhosis of liver, that is ascites, how will you manage it? It is very difficult to manage because When the patient develops ascites, it may be irreversible unless otherwise liver transplantation is done. So we have to manage it, and patient caring, that is general management, is very much important because we are treating ascites by diuretics like furosemide and spironolactone, but patient is not reducing salt and salt containing diet, and this treatment will be failed. So along with furosemide or spironolactone, we should ensure that patient is not taking extra salt in his diet, or salt containing food should be reduced. If the patient develop refractory ascites, it is very difficult to manage. We are giving spironolactone 400 milligram per day and furosemide 160 milligram per day, but ascites is not improving. Then we should suspect that the patient developed refractory ascites. In some patients, we are giving low dose furosemide or spironolactone, but patient develop hepatic encephalopathy or renal impairment. So it is also called refractory ascites. The treatment of refractory ascites may be difficult. Interval paracentesis and other treatment option like tips and ultimate treatment of refractory ascites is liver transplantation, which is very much expensive. Another problem, that is portal hypertension. We know that one of the cause of GI bleeding is variceal bleeding, and it is a dangerous problem when the patient comes with acute variceal bleeding. So we should take it seriously. I am not going in detail, but treatment principles are shown here. That is, at first you have to manage the emergency situation. You know that A, B, C, that is airway clearance, breathing support, and maintenance of circulation, and intravenous fluid must be started as early as possible to maintain the circulation. And blood transfusion is given in an urgent basis if it is necessary. Proton pump inhibitor should be started, and when it is necessary, we should prescribe fresh frozen plasma. If platelet count is very low, we should give platelet transfusion. But in case of variceal bleeding management, you must start some drugs. The popular drug is terdepressine. We should use other drugs like vasopressin, but vasopressin it causing some serious side effects like myocardial infarction or ischemia. So nowadays it is not used regularly. We should use octreotide and somatostatin. But after stabilizing the patient, we should band the varices to stop the bleeding. And the band ligation is very much effective management for the treatment of esophageal varix. After recovery, we should start the prevention for further bleeding. Worldwide popular drug is propranolol and some other drugs we should use when it is necessary. Another complication, that is spontaneous bacterial peritonitis. Sometimes acidic fluid may be infected and it may cause fever, abdominal tenderness, and sometimes patient may develop hepatic encephalopathy. So, if you can diagnose or suspect spontaneous bacterial peritonitis, you should use intravenous broad spectrum antibiotic as early as possible, that is, ciprofloxacin is a popular drug for the treatment of spontaneous bacterial peritonitis. In some patients, albumin is given for the better management of spontaneous bacterial peritonitis. Norfloxacin is used for the prevention of spontaneous bacterial peritonitis. Another important complication, that is hepatic encephalopathy, it is also a serious problem. Like other emergency, we must look for ABC, that is airway clearance, breathing support, and management of circulation as early as possible. We should start an antibiotic. We should give proton pump inhibitor for every patient, and you should correct hypoglycemia, and if there is coagulopathy, you must correct it. In some patient, there is severe anemia, and you have to manage it by blood transfusion. Other management, that is lactitol or lactulose. Lactitol or lactulose is very much important for the management of hepatic encephalopathy. Hepatorenal syndrome, we know it is another serious problem, and there are two types of hepatorenal syndrome, that is type 1 and type 2. The functional impairment of the kidney due to liver disease, but there is no structural damage, it is called hepatorenal syndrome, but there are some criteria. We should start terlipacin, and we should give albumin, and some other drugs are tried, but terlipacin is the best. We should use norepinephrine, midodrine, and octreotide. Sometimes tips are given, but it carries some serious side effect like hepatic encephalopathy. The ultimate treatment of hepatorenal syndrome is liver transplantation. Hepatopulmonary syndrome, although it is not common in early cirrhosis, but when the patient develops hepatopulmonary syndrome, we should treat it, but it is very difficult to manage the symptoms of hepatopulmonary syndrome. The features are rapid breathing and digital clubbing, which is sometimes seen in our patient. Patient may develop cirrhosis. With these features are present in case of cirrhosis of liver, we suspect that patient developed hepatopulmonary syndrome. There is no specific treatment for the reversal of hepatopulmonary syndrome other than liver transplantation. But before it, we give oxygen inhalation for the symptomatic relief of a patient of hepatopulmonary syndrome due to cirrhosis of liver. From our discussion, we learned about the treatment principle of various complications, and if we try it our best, we can prevent some cirrhosis of liver, we can treat some complication, we can treat our patient when etiological factor is known. If we provide our patient with good nutrition, which is not causing obesity and diabetes mellitus, we can prevent many of our patients for the development of cirrhosis of liver. So, thank you very much. Thank you all.